Good evening, everybody. For those of you that don't know me, I'm Pete Greensmith. I'm the Acting Assistant Director for North Wales Dental Services at Betsy Cadwallader. Big thank you to Andrew and the team for asking me along to talk to you at this event today. I've been asked to talk to you about the Reform Practices End of Year Review for 22-23 and what approach we're taking to that in the Health Board in particular. Obviously, I'll be talking about the approach we're taking in Betsy Cadwallader. However, for those of you that know me, I never really go straight into my presentation topic, so I thought it was probably best for me to talk you through a little bit about the position of dentistry in North Wales as it stands currently. As you know, it's been a very tough year for all of us in dentistry this year and the previous 2 years, coming through the pandemic and coming back out into battling with the backlogs and the issues that we had pre-pandemic that have all got worse. Alongside that, we have the current staffing issues where we know that we have a shortage of dentists, nurses and other professionals to support us in delivering our goals of trying to increase access to the public. So my view on how we deliver dentistry in North Wales is slightly different from those of my predecessors. My view is that Welsh Government mandates the Health Board to deliver primary care dentistry. The Health Board then devolves that responsibility down to my service and the commissioning teams. I like to take a best practice approach to commissioning services for quality, value for money and outcomes and then put that into operation. But what does that really mean? It means that I need to work with my practices in North Wales. We have a shortage of practices anyway. We have a challenging landscape and a challenging environment that we're trying to work in. We've got a lot of challenges ahead. We've got the ones we know about today and the ones that are on the horizon. The Health Board and its practices need to be working together to address those issues. We can't be against each other in that fight. We need to have shared goals and a clear outline of the direction that we're heading in. To that end, last year, I wrote a plan on a page for dentistry in North Wales for the next 5 years. We've written a commissioning direction for the next 10 to 15 years, and we've written commissioning priorities for 5 years that we refresh on an annual basis. All of those have been shared both within the Health Board and externally with our partners. So they've been through LDC, and they were sent out to all of our contractors also, so that we all know exactly what it is that we're trying to do. This isn't my mission, this is us as a whole in North Wales trying to deliver change in dentistry for the benefit of the patients, but also to help try and keep those practices in business. There are a lot of choices for contract holders to make currently. I want to make, being an active NHS practice, a choice that they can make and that they want to make. So part of that is my approach to how we work together. I'm a big fan of co-production and having that shared vision. And that shared vision for me is not just primary care dentistry. It's all of dentistry in North Wales. We have to work really, really closely across all of our partners, be that health promotion and working in schools and with the local authorities, all the way through to working with our consultant colleagues in hospital dental services. We need to have a shared vision of what it is that we're trying to achieve and a clear understanding of what part we all play in that process. We're really lucky in North Wales that we have a very active local dental committee and they're very engaged. We meet regularly as a health board with the local dental committee and we invite them to several meetings that we have that they can come along and give input and help us to set that direction. But alongside that, I do a lot of stakeholder involvement. So a lot of the practices in North Wales have been involved in some data collection that we've done recently around what our view on the future education, training and upskilling is in North Wales. What do we need to do to attract people and keep them within dentistry in North Wales? And there's some other projects around the North Wales Dental Academy in particular that we're out talking to practices around. We've had discussions around our EDS services and around our urgent services, and we'll continue those discussions. Anybody who knows me knows that quality improvement is something that is really important to me. You know, we've been asking about QI for a long time. We talk about it a lot as part of QAS and we talk about it a lot in the Health Board, but it's really important to me that we make that meaningful. Quality improvement should involve everybody and we should be sharing lessons learned and we should be looking to push the boundaries of what we can do by improving the quality of how we work. We have a very active oral health strategy group in North Wales, which certainly keeps me on my toes and challenges me around that direction and what it is that we should be doing. We've got a great set of managed clinical networks. The intelligence and the future vision and the foresight of issues that are on the horizon that those two groups bring to me is very, very good and very, very important in helping me working alongside my health board colleagues to understand what the problems are that we're going to see in the future. I talked a lot about engagement in that little section, and I think I need to talk now about how we're doing that. So how are we in North Wales in both the service management teams of my team and my contract management teams working with and engaging with practices? We've held a number of engagement events through COVID and beyond. We have them regularly, and we talk about subjects that we think are important, but we also ask the practices to suggest to us things they would like to talk about. We have our colleagues from NHS BSA attend those sessions also, and we normally have a question and answer session, be that through the chat on Teams or in an asking a question live if people want to do that. But we're very open and honest in our answers in those sessions, and we talk about our intentions and where we are, where we're hoping to be in the future. We encourage open access into all of the team, including myself, for people to talk about their issues and to let us know what's happening with them. Basically, what's happening in your practice, what's concerning you, what's worrying you. We will have open discussions around that. We've had, as you would expect, a lot of discussions around targets and metrics this year, where we're giving assurance to practices around where we are. Lots of queries and updates coming to the contracting team that they resolve without any resort to having to speak to me or anybody else, because they're things that are within their gifts, and my team are empowered to support our contractors in delivering what it is that they're here to do. Alongside that, we do practice visits. Not practice visits where we go with a clipboard and looking around at policies and procedures and checking through bins and drawers and making sure that things are done okay. Those happen. We have teams of people that can't do those, and we're very grateful to those for doing that. But these are practice visits where we just go. It could be me and a contract officer, it could be a team of us, depending on what the practice need is. And we come along, we just have a chat about what's happening in the practice, tell us what your issues are and tell us what's happening. And I've already mentioned previously the LDC meetings. We have attendance at project and key meetings. I've got a session, or I've just had a session by the time you're watching this, with colleagues from across the dental profession to talk about setting an education strategy for dentistry in North Wales for the next 10 years. How's it all working? Well, obviously I'm going to tell you that it's working really well, because it's my system and I want it to work. But my colleagues and contractors will be on these calls. You can ask them. You all know most of them anyway. You can ask them how it feels to be a contractor in North Wales and whether it feels supportive and whether it does actually feel like we're one big team pulling towards a goal, or whether it feels like we're against each other. So now I need to get back onto what I was actually here to talk about, and that is performance and a review of the 2022-23 performance and how we're approaching that. So what we're looking at realistically is how the practices performed against the metrics. Have they made an effort? Is there a trajectory? Sorry, I don't know why I put that word in. It's a word that I can't say. Have they made an effort, and is there a trajectory that's heading in the right direction? So has that practice made the best effort that they can to meet the target metric that is out there and on their sheet to be meeting? We need to look at the balance of patient types. We know there are different types of patients. We know we've commissioned different types of services. We need to look at, are they addressing some of that? So are they taking on the new patients? Are they looking at existing patients? But what is their ACOM mix? Have they got a large number of red patients, in which case I wouldn't expect them to be taking on a larger number of new patients, but I would expect those patients to progress through their journey. So there are a lot of different metrics that we'll be looking at to work out what the performance of a practice has been this year. We've asked for open and honest dialogue. I've talked a lot about engagement. The one thing I've asked for throughout this entire year is for practices to be open and honest with us. If you're having issues, tell us at the earliest possible opportunity. When we're doing these reviews and we're looking at end of year performance, I don't want to find out in those reviews that practice had issues in May and June and didn't come forward and tell us, because we could have done something at that point in time to assist them with those issues. One of the things we are doing, and we have done and will continue to do through the whole year, is a review of staffing levels within the practices. The main reason for this is that we want to understand the impact on practices of their current staffing levels. We know that there are issues recruiting, and we know that that impacts directly on service delivery. For some practices, that may mean that we need to have a discussion with them around, rather than getting ourselves in a position where we'll be having to do a large clawback on you next year for under delivery, we can look at whether or not we can withhold payment this year on a temporary basis in order to make that easier for you and to get us to a good outcome. So the basic position that I've stated, and I've been saying this all year and it's been misinterpreted slightly, but the basic premise for us in Betsy for contract review for this year end is that we don't aim to sanction any practice who's worked hard to meet all of their targets and can evidence good work patterns and all of the efforts that they've made to meet those targets. Where open dialogue has taken place between the health board and contracts in a timely manner, we will definitely take that into account. We will, however, impose sanctions on underperforming contracts where issues haven't been raised with us or reasonable efforts haven't been made to meet their targets. We're working in a high trust environment. We've spoken a lot about that in the last year or so. But for me, that trust is both ways. It's not just me as a health board trusting my practices. The practices need to trust us as a health board that we will do what we've said that we'll do. In year, as I've mentioned, we're working with practices who may be getting sanctioned next year because of their performance to look at whether there are ways that we can avert that by looking at withholding payment or utilising sessions in a different way, or even just having an open dialogue about what can we do to help you in the practice. But one message that I really want to get across to everybody, and this is from Betsy, but I hope this is something that is common across all of the health boards. We want to keep working with our practices. We do not want to lose practices from our areas. We want to make this work, but we have to do that in that high trust environment. This has to be a two-way discussion. It has to be a trusted partnership, and we have to have that common goal in mind, that is delivery of the best service that we possibly can to the patients within our area and to meet the need as much as we possibly can. Thank you very much for asking me to come along and talk today. I will be around on the sessions if there are any questions that you want to ask, or please just reach out to me directly anytime that you want.